Hello, everybody. So, this is the first episode of Podcast in the Bathroom. Woo! So I think I'm transforming, or I don't know, I'm changing my channel into like a podcast channel, maybe. I just become a mom, second time, obviously, because millennial mom, this channel is there. I have a toddler and a newborn, and I'm juggling that right now. And something that just pisses me off is postpartum rage. Like, you've all heard of postpartum anxiety, you've heard of postpartum depression, but postpartum rage is just this new level of anger that you have never faced. So my podcasts are going to be more about my mom life and sharing what I'm going through, or just maybe just documenting. Like, this is like my new way of journaling something. So today's topic is going to be postpartum rage, not postpartum depression, not postpartum anxiety. And I know everybody goes through this, and I had severe postpartum depression the first time around when I became mom. This time is postpartum rage. Like, I'm full on raging, pissed off. My toddler's cries is triggering the hell out of me. Everything is just triggering me. It's just annoying. Everything's just annoying me. And that just triggers my rage, which is really, really shitty because I'm taking it out on, unfortunately, my toddler and sometimes maybe my husband, but I'm not sure. So it's a topic that people don't talk about, especially I feel like from where I'm from Pakistan, people don't talk about postpartum rage. They do not talk about how pissed off, how angry everything and every single person in the world can just make you. Even people, like, that somebody's trying to help you or they're trying to give you good advice, but you're just going to be like so pissed off. Like, shut up is the only emotion that's going through your mind at that point. Or you're going to yell, or you're going to scream. And postpartum rage usually looks like screaming or yelling, or something where you're just taking out your anger, and it's misdirected anger. So that's something you should realize. It is misdirected anger. And the worst part is, you can know that you're going through it, and you know that it's called postpartum rage, but in that moment there is literally nothing in the world that you can do to stop yourself from being that pissed off. Like, absolutely nothing in the world that you can do. And that's what makes it more, like, it makes you more helpless, I guess, because you're going through it, you're experiencing it. You can be as educated and as prepared as you want, but when you go through it, there is absolutely nothing you can do. So I've always been like an advocate of mental health. In fact, my mom's a therapist, and I've like, it's just ingrained inside me, I think, at this point. But even the first time when I had my first child, I definitely went through postpartum depression, postpartum anxiety. I was at a point, I was such a low point. I live in a joint family, but at that point I was like, I'm just gonna unalive myself. I'm not gonna, I didn't want to live. I didn't want my child to live. It was horrible. And I knew I was going through it, but I couldn't do anything. And I decided to take help way, 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 way later than I should have. And I waited probably like 6-7 months before I took help. So this time I was on it. I was in the hospital right after I had my baby, and the nurse comes to me, and I'm like, I had postpartum depression the first time. I had postpartum rage the first time, and you guys didn't prepare me for it. Help me out now. And anytime a nurse or a doctor or somebody would come in, I would just like repeat this line constantly, because I was so scared to go through that again. Like, I can tell you this right now, I've had 2 C-sections. Both my babies were C-sections. They were not as painful as postpartum depression and postpartum rage is, because that mental pain will F you up so bad. You will not have anybody in the world, like, you don't think, nobody can relate to you at that point. And that's how you feel. I'm pretty sure a lot of women can relate to you, or a lot of moms can relate to you. In fact, maybe your own mom can relate to you, or your mother-in-law, whatever. But at that point you feel like, oh crap, I'm alone. I have nobody. My husband doesn't understand this. My friends don't understand this. And they can, at that point, be very helpful. They can be very sweet. They can be trying to, see your perspective. But in your mind, you're just like, oh, I'm lonely. I have nobody. I have to take care of this child. And obviously, you have a baby with you, and, you have to take care of that baby. So anyway, I think I'm digressing. But yeah, so the second time, I was on top of it. I told my doctors, I told my nurses, I told everybody who was walking in. I was like, I had depression. You have to help me this time. I'm not going through that shit again. I'm willingly going through the C-section again. I'm so not going through depression again. If you're not going to prep me, so help me God. I was like so upset at that point. So my doctors recommended me a psychologist, and the psychologist provided me with some medication. He said, okay, you know what, here are some certain medications that you can have to stop it, but you also should know that it's not something that's going to happen in every pregnancy, because every pregnancy is different. But at that point, at that moment in time, I was so terrified. I was like, no, I'm gonna have this medication, and I'm glad that you've given it to me. So I got discharged from the hospital, and my husband is like, you know what, how about you wait a week, don't have the medication, you have the prescription, you have the medication, don't have it until you feel like you're going through it. Because see, I know this sounds very controversial, but you have to understand, these medications, you can't just get on and get off them like a regular paracetamol or whatever. You have to taper them down. It takes months and months. Like, you can start them not immediately, but you can start them eventually. But tapering them down takes months and months and months and months of hard work. And I'm somebody who forgets pills super easily, so this was like something that was very hard for me. So I was like, okay, you know what, I'm not gonna take the medication. But then 2 months in, I'm almost 2 months in now, I'm going through the most ridiculous episodes of postpartum rage. And I am planning on taking therapy. I have already taken an appointment. I did it the first time as well. I'm a strong advocate of therapy. I feel like therapy is the way to go if you want to treat yourself, you want to maintain yourself, you want to, just update your mind along with your body. You should go through therapy. So yeah, I feel like every person who has become a mom, because I've experienced this, therapy should be mandatory, psychiatrist should be mandatory, but these things apparently are not mandatory. Even one of the biggest hospitals in Pakistan, which is Al Khan, they give you physiotherapy. They have a doctor come in and check you physically. They have nurses check you physically. They have 10 people checking the baby. They have 10 people checking you physically, entirely physically. But nobody comes in and clocks you and goes like, hey, are you mentally doing okay? Or, hey, let me mentally prepare you for your surgery. I feel like even like a 2-minute pep talk might do a world of a difference. I mean, compared to doing no pep talk, they should at least have like a 2-minute session before your surgery to mentally prepare you. And then maybe a session, like one, I know one session won't do much, but one session of therapy maybe, just to get you dipping your feet in the water and making you understand what being a mom is going to entail, and how you should how you're going to cope with it. Because I mean, you've seen your parents, you've seen your grandparents, or you might not have. You've seen TV, you've seen other social media influencers, you've seen somebody being a mom somewhere, somehow, right? But what it actually means in the core to be a mom, not just like I gave birth or I just had surgery and now I have a baby and that's it, yay, I'm a mom. No, it is hard. It is tough shit being a mom. And I mean, to be honest, for me, it is harder than having a full-time job. And I've been working since I was 16, to be very honest. I had my O levels and my A levels, and every time I had a summer break, my mom would go to work. I'd have to work. I had to do some internship, some job, something. I would not be able to sit at home because my mom would be like, no, you have to go work. So I'm somebody who's been working for a really, really long time. My mother's had 2 jobs at a time, but she's been maintaining the family and whatever. So I've always seen a hardworking woman as a role model for myself as well. But when I tell you that being a mom is tougher, more unforgiving, merciless compared to having a job, I am serious. I'm officially a stay-at-home mom. I have never done anything as hard as this in my entire life. And I think that is the main trigger for my postpartum rage. Anyways, thank you so much for listening. I don't know how many people are going to be listening to this podcast, but I'm going to be continuing it, if nothing then for the sake of my own sanity. Thank you for watching podcast in the bathroom because my kids are sleeping. Bye.